Okay, and this is the meeting of February 2, Tuesday, as it's been called. And all of us are here except Noreen. Is there anybody else? Anybody else with us?
Nope, just the four.
Okay.
I just texted her. I'll let you know if I hear back.
Okay. I got an email this week from somebody who is some kind of medical person. Let's see if I can find her. Who was interested. Yeah, here we go. Shira Newman. She's an RN, registered nurse at Bay State Medical, psychiatric mental health nurse practitioner, doctoral student at UMass Med School. And she was interested in the Board of Health, possibly joining the Board of Health. I told her that she would have to run against me to get on the Board of Health in 2022. And she said she didn't want to run against an incumbent. But she's interested, and that's one good thing about the pandemic is that several people have expressed interest in the Board of Health. And after all these years when we've had to beg people to run, it's kind of nice to have people coming to us and offering themselves.
You may not want her psychologizing you, though.
Well, maybe not, but maybe it would be helpful. So we don't really have much of anything on the agenda. I just figured we'd meet because we can, and in case anything came up. I gather that Walter never got back to anybody about the masks, which is kind of typical. And I gather that Noreen didn't follow up on it, apparently, or I would have heard about that. Is this still something that we feel the need to do? Sense of the meeting?
When we last spoke about this, I did say that I would ask any cases when I was doing a case investigation if they needed supplies of masks. So I can give you some numbers in terms of how many cases I've since then spoken with. It's not very many. So I don't have a very large sample size, but nobody has indicated that they're in a pinch. So.
Yeah, I get the impression that there are actually masks available and people are getting them.
Yeah, I think so.
So maybe at this point we should just let it go.
For the next variant.
Right.
Well, that's an interesting thought. But if there's a next variant, you can have my masks because I'm going to commit suicide if there's another variant. I can't take another year of this. However, I don't have that many, actually. Well, that's an interesting thought. I mean, should we be planning ahead in that way? I know that some of these masks have like a 2-year expiration date, which I don't know. What do you guys think?
My impression is that we have, 2 years left of the Biden administration, and I think they're going to make more and more supplies available. So it's
Right.
probably not urgent.
That's the way I feel about it. I mean, it would have been urgent if we could have done it several weeks ago, but we couldn't.
Right, or a year and a half ago.
Well, there's that. Yeah.
Right.
Right. Garrett, do you want to weigh in here?
I don't see a great urgency at this point. I think they're widely available. I feel like I've seen more people using a KN95 mask in the past few weeks, and fewer people using, the blue surgicals or cloth masks. So I think people have gotten the message. There's supply available. the
And
same
Garrett,
starting,
are-
the same starting to be true with the test kits too, that
Right.
we kind of moved into a place where there's more ease at getting the test kits, plus if they requested the ones by mail, they've probably started to receive if they haven't already.
Mhm. And other communities, is there any kind of a community standard that you see emerging? Or other municipalities making these things available if they, using their own resources, not, provided by the state?
Not so much on the mask side of things, but on the test kits. A number of communities have access but this is going back a couple of weeks, 2-3 weeks, maybe even more, purchasing test kits.
Other than those communities that made the cut on, the income-based cut, they met that criteria. So you're saying that there are other communities who are not on that list who have done,
Who, if they
tests.
can meet the threshold of the state contract.
Oh, I see. Right.
Yeah.
Right. I remember that. Okay.
Have any of you ordered the 4 test kits?
I did out of curiosity to see what the process was, but I haven't received them.
Same here.
How long has it been?
So I looked at it today. So I ordered for my mom on the same day, and she lives in Wyoming, and she received hers yesterday.
Uh,
Now I had a note from the mailbox today saying that I have a package because I have them hold packages. So that might be mine.
And
Oh.
so how long did it take you? Assuming that's
I want to say I did it on the 16th of January.
oh, wow. All right.
I think the form said they expected to ship within 7 to 10 days or 7 to 12 days, something like that. I can't remember when I ordered it, and I'm not sure I can find out.
I have not done it, and actually it has kind of gone off my mental list of things to do. So no good reason for not having done it. But I guess it was like Garrett just said, I would like to do it to see what the process is like. So, I'll do that after our meeting tonight.
It was pretty simple, and
Yep.
the website that you go to is actually the Postal Service,
Right.
Hmm.
Yeah.
which I
see
hadn't
the link.
realized until I did it.
Yeah, I just opened the link while you all were speaking. So, right.
January 18 was the day I ordered.
Uh-huh.
Got it.
Oh yeah, I ordered mine apparently on January 20th.
Okay.
So it sounded like the sense of the meeting is we don't need to order supplies for distribution to the residents.
Mhm. And I'm open to revisiting this if we start to hear, if we start to hear that there's a need out there that is an unmet need,
Mhm.
that we can have some sort of a strategic stockpile of our own, maybe. I don't know.
That's an interesting thought.
That's another idea. It's possible that we could, order something like 100 of them, not these thousands and thousands, and just have them agree upon a place where they will be stored, and then if the need arises, like I'm working on some cases where people are really stuck and they have no, I think most people do their ordering of things online these days,
Yeah.
So even if they're in quarantine and they've still got access to, but anyway, I'm just thinking out loud here.
Mhm.
Is there any reason for us to just have a stash somewhere? But
I can't
probably
think
if
of
we-
any really.
Yeah, if we really needed a stash, I imagine that Walter could provide us some and then we could replace them for him. No?
That's probably true. I know he brought a box of masks for town hall personnel to Becky a few weeks ago.
Mhm. I mean, it would help him rotate his stock for us to
Yeah.
do that anyway.
Right.
Okay. Well, I will try to keep my ear to the ground as to whether or not there's a perceived need in town, or more than a perceived need, an actual need,
Right.
that where people can't get them elsewise.
If I see Mary Ann in the next few days, I'll ask her what she's hearing.
Okay. Kat, should I go on about what I communicated about the onboarding to Maven?
Yeah, go ahead.
Okay, I conveyed this information to Kat the other day. First of all, in Maven, our numbers have declined quite a bit since we last met. Since our last meeting, I have had a total of 8 cases. And that's compared with the 2 weeks between the January 4th and 19th, so that the preceding 2 weeks, I had 23 in Maven and 11 self-reports from home tests. So for a total of 34, compared with 8 in these past 2 weeks. So it's really come down quite a bit.
That's dramatic.
Yeah, so may it keep going in this direction, please. And when we last met, I talked about how I would investigate what was involved with bringing Wim on as a Maven user, so that if I am unable for whatever reason, there's another Board of Health member who can do this. And it's not without some challenges. There's an online form that has to be completed. That's pretty simple. The new user must have, they will not use a personal email address to onboard the person. They must have an email address that is affiliated with their town or whatever organization they are doing reportable disease work with. So in Wim's case, it would need to be an email address that was affiliated with the town and that had his name in it. I don't have such an email address, but I've been sort of grandfathered into this from having used Maven for many, many years. So, but new users have to have this particular type of email address.
Let me interject here
Yep.
that I asked the web committee if that was a possible thing, and they said no problem.
Okay, good. There is a set of training modules that have to be completed. They're online things. And then the new user has to complete a proficiency test. And the new user is required to be actively involved with case investigation, contact tracing. There's not like some minimum number of cases, but they can't just be a bystander who only logs on to read case information. That they have to be performing the case investigation work.
So the idea is they don't want people lurking who are just
don't
kind
want
of
people
snooping.
lurking. They don't
Yeah.
want people snooping, right?
Well, presumably Wim wouldn't log on except when you weren't around and he needed to check.
Well, but there's the last requirement that I was going
Oh.
to say, and that is that
Oops.
a new user must log in, any user must log in a minimum of 1 time per week, or their account will be deactivated.
I see.
So
That's kind of a
No.
catch-22 there.
none of these is insurmountable, I don't think, from, I don't know how Wim feels about this, but none seems terribly insurmountable, but there's a time expectation, and using this, there's, as with anything else, there's this learning curve. And if you're not doing it very often, it's hard to get very far along the learning curve, And so Kat, when I communicated this to her, said, well, we do have Mary Ryan, who's she does this work for Leverett. But I didn't realize we still had her kind of in the wings.
Well, we have a contract with her, so if she's still willing, we could have her do it.
Yeah, I thought that contract ended the June of the fiscal year. I thought it was a short-term type of thing. I didn't realize it was ongoing.
Oh, well, I'm not sure about that.
Okay, so maybe we should find out about that.
Yeah.
And then Claudia Lucas, who is our health agent, she does this for, I think she does it for Southampton. I don't know how much she works with it or whether she sort of delegates to other people or something, but so that's the information that I have. And I'm interested in how, in particular, how Wim feels about this, but is it something to move forward with here, or should we draw upon our other resources when I'm out of town?
Well, Wim, that's your call.
Well, it sounds like getting on board is not that big a problem. It's the frequency of use. And if I'm the backup person, I doubt I'm going to be doing it weekly. It seems to make sense if there are other people affiliated with our Board of Health who are already users. It does seem to make more sense for if one of them would back up, but I'm willing to do it. I just don't know how I would stay current.
Yeah, I agree.
When I'm not on call.
Yeah, and I keep hearing about towns that are, especially in this past surge, that embarked on some sort of a cooperative agreement. I think that Northampton and Amherst, along with a bunch of other towns, are in some sort of a collective where they are helping one another out as they're able to. And so that's a concept that I think makes a lot of sense, has a lot of merit, where people who are practiced can just pick up our small numbers. I mean, I hope that our numbers stay nice and small. So I am happy, really, I'm happy to work with you, Wim, on whatever. If you really wanted to do this, the onboarding process is with with DPH, not with me, but where I could share the work of some cases that as they come up, I could involve you on them, you know, and help you get some practice and kind of be looking over your shoulder and that sort of thing. But it may be not worth it.
Yeah, I could imagine. I've been shut out of other online services for being a very sparse user. So I, not remembering to renew and
sure.
I could imagine that would happen.
Okay. All right. Well, I'll make an inquiry to Claudia and about her availability for backup work. And in the meantime, I guess I can communicate with Becky Torres to find out whether or not our contract with Mary Ryan is an ongoing one.
Well, I've got an email from Mary. I was thinking I would just send her an email and ask her if if she knows that the contract has expired, and two, if she'd be interested in doing it. Right. And if the contract is expired, presumably we could renew it.
Okay. And you could maybe let her know that our numbers are Well, I'm sure she knows Leverett's numbers are not going to be very different from Shutesbury's. So
Most like.
she knows that things are lightening up.
Do they post theirs? Have you seen their website? I haven't even thought
I
of
have
looking
not
on it.
looked. You can go to, I get once a week an email from the state that lists all the towns in the Commonwealth and what their total number of tests and how many positives. That's not the same as saying how many people, because sometimes people are tested twice. So
yeah.
there's some duplicates in there. But Shutesbury, we are running for these last 2 weeks at a 1.6% positivity rate. Amherst is about double that. I could look up Leverett's. But maybe they have a dashboard on their town website too. I don't know.
Yeah, I'm not seeing one.
Uh-huh.
I mean, I guess I understand why the state has implemented these requirements in COVID times, but in terms of trying to create primary and backup people who can do case investigation and contact tracing for non-COVID diseases, I mean, I don't know, it just doesn't make a lot of sense to have so many barriers in place that you can't, have somebody who can step in when the primary person is not able.
Right.
Right.
Maybe they're afraid of what happens when a person has not logged in for a long time and how they have not stayed current with the changes, because they're changing stuff all the time.
That's
Leverett has had 13 positive tests in the 2-week period on this table that I'm looking at. Again, that there can be some people who were tested twice there, but as opposed to Shutesbury's having had on this table 6. So for what that's worth.
Right. Okay, well, I will, yeah, maybe it would be good to talk with Becky instead of Mary herself, because I'm not sure about the contract thing, about whether it is renewable, because of, I don't know where the money for that came from.
Yeah.
However, we do still have money in the district. We haven't spent that. So we could conceivably pay for it that way. I'll get in touch with Becky tomorrow.
Okay.
Okay.
So the contract that we did have with Mary, I just did a search in my emails. It looks like we set this up in December of 2020. And I thought it was only
Well, the personnel action was actually taken in March of 21.
okay. All right. And so we'll find out. You will contact Becky, is that right?
I will do that, yeah.
Okay. And we'll find out what the status of that is.
Okay.
Okay. Very good.
Okay.
Thanks.
And we've got a little time, right? Because it's not until late in April when you're going to be gone. So we have some time to sort it out.
Right. And I may not be going if this 10-day self-quarantine requirement is still in place, then
That's
we
not going to
won't go.
work.
Yeah.
Right. I hope you got trip insurance.
Well, everything is cancelable, so we're good.
Oh, good.
We made sure to only book things that were cancelable.
Good planning. Is there anything else that we would need to talk about tonight? Or want to talk about?
I think we just have to approve the minutes. I don't think we did.
Oh, right. Thank you. Can we approve the minutes? Everybody like them?
Yeah.
Yes, I did.
All right. Thanks, Garrett. I always forget the minutes if I don't write them down. Right, and we didn't have any unanticipated business, or indeed any business. I
No business.
I have sent several emails and a private message on Nextdoor to Greg Steves. I know he's around because his name pops up now and again, but he is not answering my emails. And I don't know what's going on at the house. Last we heard, they had taken samples. I mean, he had a contractor, and they'd taken samples for hazardous materials, and they were waiting for the results. But that was months ago. That was like October or November. So I'm getting a little annoyed. I know that he's got health issues and whatnot, but I also know that he's out doing plowing and stuff like that, apparently. So I'll just keep trying, and I can always call on Ken, because Ken and Greg are close, and if I need to light a fire under Greg, I can probably get Ken to do it.
Okay.
I don't think I have anything else.
Okay.
All right.
All right,
Do I hear a
well,
motion to adjourn then? Or do you want to add
So
something?
moved.
Second.
All in favor?
Hi.
Anybody not in favor can leave right now.
All
Okay, let's be adjourned at 7:30, and Arlene, you and I can communicate about about finding a backup for you.
Okay, thank you.
Okay, thanks, you guys.
Okay.
Thanks, everyone.